Hello.
Hi, Maura. How are you?
Well, thanks. How are you?
Good. I know we're going to be doing this as our consultation for our project. I would like to talk to you about one of my athletes. She's a collegiate soccer player, and she tore her ACL about 6 months ago. She's been progressing normally now for several months. One of her teammates tore their ACL about 2 months prior to her, and now the teammate has progressed quicker than the original, and I think like she's the original girl has very long standing medial knee pain. um we have tried to treat her for like quadriceps tendonitis, maybe looking at referred pain. We've tried some laser for nerve, and her MRIs are negative, so we're trying to figure out what exactly to do about it because she can't return to play with this pain. It's just inhibiting her playing. So I just like wanted to talk to you about this and figure out like where we should go from here. What you think?
So, is she like full weight bearing,
She is full weight bearing, yes.
or does she have any altered gait? Is it just like during playing that she has this pain?
Like she has pain throughout the day. It's just like she hasn't even returned to play yet. Like she can't get through. Um, I think she's been doing maybe something like she's been doing like sprints and stuff, but like then that's when it all started. So now we've taken her out of return to play protocol and functional, and now we're back into just maintaining strength, like with straight leg races and such.
Okay, that's what I was gonna ask. Is she bilaterally like baseline when it comes to hip strength, especially, and then quads and hamstrings?
Yeah, like those are all showing, like we've used the Biodex test, and those
Okay.
all showed that she's within normal limits. Like she should be able to return to play based on her strength, but we just don't know why she still has that pain.
Okay. How does she describe the pain?
She says like it's a deep, but yet it does like tend to throb, but like
Okay,
it's not ever really sharp. It's more like a dull ache, but it's all the time.
gotcha. So
Weird.
does it wake her up at night? Like how is it
Um,
affecting her outside of just sport?
it is affecting her outside of sport. I mean, she lives on the third floor of her apartment, and she said like she can barely walk the stairs. So that's definitely affecting her. We haven't even tried putting her back in play yet because of all the issues she's been having. She's walking to class, but she's in a lot of pain, and she can't. She still goes to practices and such, but like she's always on the sidelines doing quad sets, core, lower body, and upper body, like trying to strengthen to figure out what's going on. And she does her regular rehab. Like we have her on a full body like management, standard management and strengthening. So
Hmm.
unfortunately, it's still not doing anything.
Does she have any like hyperesthesia? Like, is she sensitive to touch?
Not that we know of, no.
Okay, she can wear pants and all that kind of stuff.
Yeah.
Like, okay.
Yeah.
Does she have any history of a knee problem or a hip problem on that side?
This is her second time tearing it. The same ACL.
Okay. Did she
Good.
and the pain? You said it's medial. Is it like superior patella, inferior, or just right on the medial border?
It's like it's almost superior, like it wraps around, so it starts superior. Like if I'm doing ultrasound on it, like it'll start superior, but like it'll go into the joint line a little bit, but it's not a lot underneath. So like we've eliminated patellar tendonitis. We thought maybe it was kind of referring all the way up and around, but that doesn't seem to be the issue. And even with her quads, like we've been doing a lot of eccentrics and maybe we're doing a lot of SASTM to see if that's breaking up the tissue, but like we're not seeing any results of that either. We even tested for meniscus. Maybe we're thinking, that deep pain right there, medial. She could have like torn it when, during rehab or something, but that's also negative.
Hmm. Have you done well, one, have you been measuring any of her like health related quality of life stuff just in surveys? Because this sounds like it could get really frustrating.
No, we haven't.
Okay, I'm just thinking, especially if she has been out longer. She had, like you said, the teammate that tore 2 months previous, and she's already like back into the swing of
Yeah.
things. Making sure that those little I can't walk to my own apartment things don't eat away at her so much that,
Oh.
you know.
Yeah, maybe that's a good thing to consider though, because yeah, we haven't really measured that. We've been measuring a lot of her like girth, we've been looking for like swelling, we've been looking for functional, we've been looking for strength and range of motion, and like all of those are showing normal, but I guess we haven't even considered just using an outcome tool.
Yeah. So I would say in addition to like the patient related stuff, definitely like quality of life, because once you're in that chronic cycle, that can become this big black hole of it's one really, really hard to pull them out as
Okay.
an athlete to return to play, but also as a human being, like let's say she ends up quitting soccer because she can't return. You don't want her to be stuck in that like depressive state
Yeah.
of I can't do anything that I want to. But also it sounds like um, even if the pain is just like a deep throbbing, has she had any like blood testing done or any?
No, we haven't done that.
I'm only thinking like if you just go by it, the like, kind of orthopedic process of elimination would be MRI, but also if you go to like a rheumatologist, just see what could something that could be going on there, and then or like an occupational therapist, they could help her at least with those activities
You're
because
right. Yeah.
with occupational therapy, they may not be able to say, here's how we're going to take your pain away. They say, this is how you're going to be able to do all of your tasks with the pain you already have.
That's really cool. Yeah, no, that's a good, because I know that my school that I'm at right now has access to those resources. We haven't even considered it though. That's actually a really excellent idea.
Yeah, that way she could at least function. And
Yeah,
sometimes once you're in that, like, I'm really interested in the pain spasm cycle, which is quite literally like pain. You spasm. When you spasm more, you have more pain. But within that cycle, you get a lot of psychological components where it's like, I'm in pain, I'm spasming, so I'm causing more pain. Now my brain is shutting
yeah.
down. And so
I
once
think
you stop trying to heal,
yeah, and her that being her second one, it's already discouraging.
right?
And she's a freshman, so that means like I think she just wants to play.
Yeah.
So I think that that also could be contributing as yes, that's a good thing. We should definitely look into those.
Yeah. And so that, I mean, that'll help her physically and with quality of life, even with the OT stuff too. So.
Absolutely. Hey, that's awesome. Thank you so much. I think I'm gonna go take this to my supervisor and we can figure out how to go from there.
All right. Sounds good. Thanks.
Thanks again.